Good morning, Professor. I am Chastity Johnson and am currently enrolled in the NRN 488 online class for healthcare policy development. For this assigned project, the student is to describe and defend their personal position on a health policy of their choice. According to the World Health Organization, their definition of health policy refers to the decisions, plans, and actions that are undertaken to achieve specific healthcare goals. In other words, just by mapping out a vision for the future of healthcare would be enhancing the healthcare system's priorities and references. There are numerous of health policies being created, altered, and argued across the nation. A few examples would be the support for comprehensive reproductive health education in public schools, and the support for the Affordable Care Act. While those two policies alone are two big topics in health policy, only one sticks out from the rest. Health policy of the Mental Health Parity Act of 1996 is a federal law that gave annual and lifetime dollar limits on mental health benefits without lowering the cost compared to the medical and surgical benefit dollars. In 2008, the U.S. Department of Labor continued to improve the Mental Health Parity Act by establishing the Mental Health Parity and Addiction Equity Act. This act assured that the benefits of group health plans and insurance users would not be restricted to or from the predominant requirements or any limitations. The position to be fought here is that there are signs of limitations on mental health. If a patient requires any type of medical services, then that patient should be given every opportunity and option available for treatment. Because the Mental Health Parity Act of 96 didn't give mental patients the same attention as other patients, it can be strongly said and supported that the MHPAEA advanced the regulations and further extended the care of mental patients. Just because a patient doesn't have surgical needs doesn't mean they are any less of a patient in need. Patients who suffer from mental health, in some cases, do require medical attention because they could be a threat to themselves and others. There may be many forms of mental disorders, some which are in fact sound harmless, but that does not exclude other mental disorders that could cause harm. In other words, physicians, health insurance companies, and the public in general should not take the mental health policy or policies lightly. They were written to help provide and serve all patients and their loved ones in need. It cannot be any more stressed on the importance of mental health awareness. If health policies can have limitations on an individual's health, then what would be the point in caring and making the world a safer and healthier place? There shouldn't be any limits on mental health policies. The only valuable information this policy should contain is the regulations and guidance to improve the health policy itself and the patient's understanding of their condition, treatment availability, and payment of treatment. And that is why I chose the mental health policy, because it's not many people are aware and not many people have much information on it, and I think it is just, people need to be more aware, and there shouldn't be any limitations or any cutbacks just because there's not advanced surgical being done on them. All medical cases are all the same, patients in need, physicians, rules, laws should all be treated equally.